Dr. Michael Dunn's preparing for a seriously injured man who's been crushed by a quad bike.
He's been ketamine and propofol drawn off in case he's in absolute agony.
50-year-old Len was out with a group of mates having his first ever quad bike ride when he crashed at high speed. He was catapulted over the handlebars and trapped under the 300-kilo bike when it landed on top of him.
With quad bike or motorbike accidents, we are concerned about spinal injuries, a significant head injury, because the patient's not harnessed in like they would be in a car. So something we need to be particularly wary of.
Hi, guys. Do you want to do a hands-off handover and just get the story? Then no worries.
Len's injuries may be very serious, and his wife and children are unaware he's been airlifted to hospital.
This is Len. He's been riding a quad bike around about 4 o'clock today with some friends when he states he was going around about 75 kilometres an hour when his front wheels have impacted a ditch, which has caused the quad bike to sort of flip up and throw him forward from the quad bike. We believe that he's then landed on his head with an impact that's quite significant, causing his helmet to actually crack.
Oftentimes, the knee-jerk reaction is to jump in and start examining the patient and checking them head to toe. Handover is when we get a full story about the patient and what the paramedics had found. Without the actual story to give a context, things can get missed.
He's got significant deformity over to his left shoulder, significant pains to his central spinal region around T1.
Is that all right?
My name's Alice. I'm on the trauma because Lynn's going to move you across.
1, 2, 3.
Well done, Lynn.
Left shoulder, possibly clavicle or anterior dislocation, back and head injury, GCS 15, hemodynamically stable, chest, abdo, pelvis fine.
All right, Alistair's just going to pop in and have a quick listen to your heart and lungs, and I'm going to do an ultrasound at the same time, okay? Keeping that head nice and still for us.
Taking nice deep breaths. That's okay.
Whenever we have someone coming in with high-speed accident, our main concerns are life-threatening injuries. Things we'll be looking for would be fluid around the heart, collapsed lung, some bleeding around the liver or inside the abdominal cavity.
Any pain here in the pelvis? No.
Good air entry. You don't feel like an organ in your head.
Shoulder, you think that's...
Let's have a good feel of the clavicle.
Dr. Michael begins examining Len's injured shoulder.
Sore there, is it? There.
From examining Len, we can tell that there's some deformity around the collarbone. So the X-ray will help guide us to see exactly what the level of injury is.
Yeah, he's fractured mid-clavicle there.
Whenever someone gets a significant impact to their side, either the shoulder is going to be injured or the collarbone will take the brunt of the force. So it is quite a painful injury because whenever you take a deep breath in, the collarbone will move and that will cause pain.
The X-ray confirms a badly broken collarbone, but it doesn't show if Len has spinal injuries.
What's the sorest bit at the moment?
It's the middle of my back. I don't know what's wrong.
Who was with you at the time? Just keep your head nice and still, okay? You're doing a good job.
Two things.
Okay. And what happened there? Did they help you walk, or did you have to wait for an ambulance?
Yeah.
Couldn't get up.
My legs ain't good.
Back's going to be a little bit concerning if he hasn't moved since...
Can you wiggle your fingers in this left hand from the face? Does anything feel numb at the moment in the hands?
Yes.
In this situation, we're very concerned about Len's spine, particularly given the degree of pain he's in.
We're going to roll you onto your side and have a feel of your back, all right?
Back in trauma, Dr. Michael Dunn's seriously injured patient Len is lucky to be alive after a high-speed ride with mates went horribly wrong.
Now, this will hurt.
The father of two was riding a quad bike when he hit a ditch and was thrown into the air, landing on his head.
1, 2, 3.
He was pinned under the bike and has suspected back injuries.
Is there anything sore at the back of your neck?
Yeah, very sore. Yeah.
So the main thing was at the base of your neck.
C7, yeah. You're pretty sore over the base of the neck there at the spine. The other concern, there might be a crack there. You let us do all the moving. 1, 2, 3.
we're concerned about a spinal injury. The worry is that the bone may be unstable and that any movement he may do will actually cause some injury to the spinal cord or surrounding nerves. So it's quite important that we keep Glenn completely straight and immobilized until we can ascertain, is there any significant unstable injury?
If we could just give CT a call and let them know we're coming around.
Dr. Michael fears that Len's spinal cord may be damaged and he could be paralysed permanently.
Do you quad bike a lot, do you?
No, motocross. Two-wheelers. We were short one motorbike. I decided to hand my bike over to a friend and, yeah, I rode the four-wheelie. Bad decision.
This has obviously been a very traumatic injury for Glenn.
Until we get this collar on and get the orthopedic surgeons, I want to keep your head basically and back flat.
While we do focus on the treatment and the medical side of things, it's also important to see that this is going to affect their life moving forward. So a large aspect of our job is to be able to reassure patients and get them on the right track.
Men, we're watching you the whole time because you need us urgently. There's a microphone in the machine, okay?
I suspect that he might have a fracture of his lower cervical spine, which is the base of the neck. And given the mechanism, the fact that he was going 75k and came off, there is a chance he may have something in the brain. So we're gonna bring her around for a CT scan now, okay?
50-year-old Len was riding a quad bike for the first time when he crashed at very high speed. The father of two was trapped under the 300-kilo bike when it landed on top of him. Dr. Michael Dunn believes Len could have life-changing injuries.
There, he's come through the back.
One of the spinous fracture. Yeah, he does.
The CT scan reveals he's broken his back in 4 places, fractured his ribs and punctured his lung.
Len has multiple fractures to his spine high up and also around the mid-back area. I think that given the fact that Len went over the handlebars and landed on his head, that potentially could have led to a significant head injury, and he's extremely lucky he doesn't have any neurological deficits, having had such a significant hit.
But it seems that you cracked the bones in the spine, so I want to keep your head and back flat.
Len's fractured back is being protected with a collar. If one of the broken bones dislodges, it could crush his spinal cord.
Yeah, that's perfect, you're right. So we'll get the orthopedic surgeons in to see you, okay? Your job is to keep taking deep breaths in. If you don't take full breaths in and out, parts of your lungs don't fully expand and you can get a chest infection. And if your pain gets very bad, just put your hand up and we'll get you some painkillers, okay? All right, come on.
Len retired 4 years ago and regularly goes off-road dirt biking. But a generous gesture to a mate has changed his life forever.
I decided to hand my bike over to a friend and, yeah, I rode the four-wheeler, hit a ditch and just got catapulted off it and the thing just rolled. And when I stacked it, I couldn't feel my back and I couldn't move this arm and I just thought there was something bad wrong. I knew something was wrong.
His son Jesse is on his way, while Len waits to hear if surgeons will have to operate.
But I shouldn't have been riding that four-wheeler. First time and last time.
Back and head injury.
Dr. Michael's patient Len was airlifted to hospital after a high-speed quad bike accident in remote bushland. An experienced dirt bike rider, it was the 50-year-old's very first time on a quad bike, and it ended in disaster.
It's in my back. I don't know what's wrong.
The father of two broke his spine in 4 places, fractured his ribs and punctured his lung.
I guess they wouldn't give you the remote to adjust the bed just in case you wound up doing something.
It's now been 5 days since his trip to emergency, and Len is now recovering in a ward with son Jesse by his side.
I thought I was dead. I thought I was going to die. That thing rolled on top of me, that four-wheeler, like I was nothing, and I was just a bag of potatoes, and that was the, 250 or whatever, 300 kilograms smashing on top of you at the same time. It's not good.
Jesse's grateful his dad survived and that his injuries aren't much worse.
It's very terrible what's happened, but I'm super glad that he's still okay. He's the best dad I could ask for. Without him, we would be... I can't even imagine, honestly. He's absolutely everything to me. He's my best friend, he's my dad. Yeah.
Fortunately for Len, doctors decided not to operate on his back.
I suspect Len will actually make quite a good recovery after this injury, but it'll be a long process. And I think with multiple broken bones, it's going to be a lot of pain and a lot of rehab involved. But I think he's come away quite lucky.
And what is Len looking forward to doing once he recovers?
Can I say this on TV? I'm so looking forward to scratching my bum. On my own, which would be good, yeah.